morning. I am Dr. Pradeep G, Nayar, Senior Consultant Interventional Cardiologist at Fortis Malar Hospital, Nayar. Today I'll give a few tidbits on salt and sugar in your diet because this is a regular question that people ask me when they come with cardiac problems. Now let me tell you, both sugar and salt, both are absolutely necessary for your body and for all the functions of your cells. In fact, your brain can only metabolize sugar. So if you don't take sugar, your brain won't function properly. So this is the reason why I want to tell you that both those sugar and salt, both are needed. Now, how much is needed and why we are always worried about taking excess of this is the reason. Now, how much salt you need? You need only about 500 milligrams every day of salt. And the maximum permissible is 1500 milligram, and that is approximately 3/4 of a teaspoon. So imagine how much salt you actually need. And then we add so much salt in today's world of fast foods, all pre-prepared foods and all, where we don't have any idea how much salt goes into it. We take these food items and we land up with problems because high salt intake can cause hypertension. It can cause fluid water retention in your body, especially if your kidneys are not working well. So once you have hypertension because you're continuously taking high salt with all this fast food and junk food, what happens is you start developing blood pressure. Now the problem with blood pressure is that it can damage all the blood vessels in your heart, all the blood vessels in your body. It can cause strokes, it can cause heart attacks, it can cause kidney failure, it can cause eye problems. So hypertension is avoidable as far as possible, and this can be done, at least contributed to, by reducing the amount of salt to maximum 1500 milligram per day. Coming to sugar, sugar is needed for all the metabolic activities, and as I said that your brain needs only sugar, but the maximum sugar is 30 milligram. 30 milligram. So that we always exceed, and 30 milligram is maximum, about 2 teaspoons. So you can imagine that's the only thing required by our body, because sugar and carbohydrates, all other food items, they contribute to the production of sugar in the body. So taking extra sugar, sweet drinks, all this aerated drinks, all this increases the sugar levels so much. Now, of course, diabetics know that sugar is not good for them, so they may be avoiding. But the people who are not diabetics, they may think I am not diabetic and therefore I can take as much of sugar. No, that's not that's not what should be done, because excess sugar can make you susceptible to diabetes. Second, even if you are not diabetic, what happens? This sugar causes a lot of inflammation in the body because the hemoglobin gets glycated, what we call glycated hemoglobin. So the hemoglobin gets attached to the sugar molecule, and this becomes an inflammatory molecule in the blood, and this causes a lot of plaques, the atherosclerotic plaques that we see in patients with heart attacks. So sugar and salt both should be taken in very controlled manner. You can land up with hypertension, you can land up with diabetes, you can land up with heart attacks, strokes, kidney failure, eye problems, if you do take an excess of these two items in the food. Earlier, before fast food and this high-stress living was there, earlier about 20-30 years back, our diet was reasonably under control. Now, but with all this pre-prepared food, packaged food, fast food, what is happening is both the sugar and the salt intake is very much higher, especially in the younger population who rely on this type of, because of their lifestyle, they rely on fast foods to, as part of their lifestyle. So this is an issue, and I would suggest that all of us should reduce sugar intake to 30 grams per day, that's around 2 tablespoons per day, and salt to 1500 milligram per day. Thank you.